for if you need food or childcare, or if you've had a job loss, or if you're a business, there's a section for you to talk about what to do if your employees are sick. And that is www.covid.virginiaspelledout.gov. I was going to pull that up for you this afternoon, but they're still working on the site. It's brand new. But that's covid.virginiaspelledout.gov. We had some questions last week. People want to know if they're ill or feel like they have COVID, what should they do? The very first thing you should do is call your physician, describe your symptoms, your temperature, and so forth. If your physician feels that you need a test, they will write a prescription for you to take to the nearest testing facility. And if your symptoms are severe and your physician is concerned, they'll ask you to come to the hospital. So that first call goes to your physician, and then there's a process after that. Let's go ahead and talk about what we're doing, the health department in particular, during this time to make sure that we keep your food supply safe. So I'm going to ask Jessica Phillips. What is your title, Jessica?
Environmental Health Technical Specialist.
Environmental Health Technical Specialist. Mm-hmm. Can you kind of go over some of the types of questions you're getting from folks in the food service industry?
Sure.
And what kind of guidelines we're having to work through?
Okay, so currently food facilities, restaurants in particular, are operating under Executive Order 53, which is from Governor Ralph Northam. And basically those restrictions include the closure of dining rooms. So no one is allowed to sit in the restaurant to eat. It is takeout and curbside or delivery only. Now, if patrons want to come inside to place a takeout order, they can do so. However, there can be no more than 10 patrons, and they must maintain 6 feet of social distancing.
Is that why we're seeing stripes on floors all around town?
That is correct. So some facilities have taken that initiative to put down tape to actually measure out how much is 6 feet so that one person to another knows where to stand to maintain that social distancing.
What kind of concerns do the restaurant owners and managers have?
Well, I've heard from several restaurants they're concerned about being able to remain open because of the business side of things has kind of went down. Mm-hmm. And they're trying, different things such as home delivery service of orders. So if a customer calls in and says, hey, I'm not able to get out of my home, but I do want to place a food order, can someone bring it to my home? So some restaurants that normally weren't offering that are now offering that service to kind of help keep their sales up.
And if I'm not mistaken, that executive order is in effect till May 8th?
May 7th at 11:59 p.m.
Okay, and I understand the governor is looking at some things that we can do to get some of the small businesses back open, including restaurants, such as taking out some booths or having people make reservations so that there's no more than 10 patrons in the restaurant at the same time. I think it's going to be very complicated to get our food establishments back open. But I do know there's a lot of discussion about it, and it's one of the governor's priorities. And by the way, if you want to hear what he has to say, he comes on Monday, Wednesday, and Friday at 2 p.m. You can look at his Facebook page, or WDBJ hosts that locally live. And it's 2 p.m. Monday, Wednesday, and Fridays. All right. So I'm a restaurant owner, and I have a question about an employee who may or may not have COVID. Do you get any of those calls?
I do get those calls sometimes. Maybe there's an employee that's exhibiting symptoms. Maybe they have a cough, fever, and or difficulty breathing, maybe chest pain. Usually it's someone that has a fever. Most of the time someone goes home and discovers they have a fever, didn't have it while they were at work, so basically they don't come to work. Obviously because they're sick. So they just contact their medical care provider. In some cases, if you don't have one, then you just go to your nearest ER or urgent care facility. And if they feel that those symptoms are consistent with COVID-19, they'll do the appropriate testing. And during that time, they'll need to remain at home, self-quarantine, until they receive that diagnosis.
Okay.
If it was to be positive, then they'll need to remain in isolation, quarantine at home, and then they'll have to look at those contacts if there were any between that person.
Okay.
For at least 7 days, unless they are fever-free without any medication for 72 hours.
I do want you to understand that testing is fairly simple. and it's free in Martinsville. So if you live in that Martinsville and work in Franklin County, you can certainly avail yourself of that. If you do not have a regular doctor, an urgent care will be able to help you, or you can call the hospital and tell them you don't have a doctor, and they can advise you from there. In terms of food inspections like you normally do, are you still carrying on your regular restaurant inspections?
During this time, the Environmental Health Department is on limited services being offered. So we are not conducting routine inspections inside of food facilities. So what are we doing? So we were given guidance that we can conduct training inspections over the phone with our food operators of our food facilities. And we basically discuss how we have a script of questions we ask, what are they doing right now in response to COVID-19? And we take those responses and we can enter that in the computer as a training inspection, and it will push the next due date for the next inspection further once this is lifted.
And understand our farmers markets are starting to open up with some social distancing measures as well. Do we have anything to do with making sure they're in compliance?
Well, farmers markets, for the most part, typically fall under our sister agency, which is VDACS, or Virginia Department of Agriculture and Consumer Services. They do have some guidance, so you can visit their website to find out more. And we also did receive an email of literature. So if you have questions and you're not able to make contact with our office, you can contact our office and I can help you with that. The question come up about the 10 patron limit. How do farmers markets, handle that? What do they do? So basically farmers markets can do like a drive-through or a curbside type market where the vendors themselves maintain social distancing from one booth to the other. You can pre-order ahead of time and basically pick up type service to kind of limit bottlenecking. Basically.
So basically the farmers would load the produce into bags and bring those directly to your car.
Yeah, that's correct.
That's awesome. That's awesome. Anything else regarding food inspections? We don't have any events that you're having to do any inspections on. What about food safety at home? Is there anything you can recommend to make sure, especially during this time, that we're not passing on things to the folks that we live with?
Sure. Now, understand that COVID-19 and the research has found that it is not transmitted through food. It is transmitted person to person and surfaces. So if you touch a surface and then touch your face, it can be transmitted that way, but not through food. However, just be aware of the surfaces that food may come into contact with. So you want to sanitize and disinfect those surfaces. You can use sanitizing wipes, or you can look up the EPA website. There's a listing of disinfectants that are used against the COVID-19 virus.
Great. Well, I think that's very informative. We don't have anything to do with the meat supply, correct?
That's actually under VDACS. They have a meat and poultry inspector for that department.
And understand there have been some clusters of illnesses at meat packing plants in other parts of the country, and so they're speculating that we will probably have a shortage of meat or higher prices of meat further down the road because they don't have anyone coming to work.
Right.
And that's going to be among many of the adjustments we have to make. We want to encourage you guys to give us a call if you have any questions, and also to please check out the www.covid.virginiaspelledout.gov. There's actually a section on there for small businesses to ask questions, and they're pretty thorough. What do I do if one of my employees is sick? What are my responsibilities regarding cleanliness after someone in my building has been sick? It's very comprehensive, and I learned a lot of things just looking at it this morning. Let's see what else we have to do.
Something else I wanted to add is to make sure we're properly hand washing. That's your top #1 defense against COVID-19. So at least for 20 seconds, you want to properly wash your hands with soap and water. So basically that's equivalent to singing the happy birthday song, or maybe the row, row, row your boat song.
Okay.
So if you want to sing it out loud, great. If you're not that, hands, and then if you have to go out through a door, make sure you use that same paper towel to handle the door handle, and then dispose of your paper towel on the way out.
There's so much to think about. I know I've seen people coming out of the grocery stores with gloves on their hands, and they get in their car and they touch the steering wheel and the keys and the seat belt. So I guess the guidance on that would be, if you're going to wear gloves when you get to your car, to take those off and dispose of them properly before getting in your car, so that you don't, in fact, spread the virus.
Right, and you want to make sure you wash your hands before putting on gloves and after taking off gloves, and not touching your face, because then you could transpose whatever's on that glove to your face now, so then you're not protected.
Last time we talked about thinking about the virus as glitter, and you touch some glitter and how hard that is to get off your hands, even with hand washing. But you have the glitter, and then you touch something else and it has the glitter, and a little bit more goes on the next thing down the row. And we know from the CDC that the virus is living on these surfaces for hours at a time. Last week you all asked about animals and COVID-19, and I told you absolutely not, no pets, and I have to correct that. A veterinary clinic in Chapel Hill, North Carolina, just to our south, has diagnosed the first dog with COVID. He was at home with his owners and their teenage son. All 3 humans had COVID, and so the animal has tested positive as well. There's still no evidence that animals can give us the virus, but there have been 2 cats that also have contracted the virus from their humans. So if you love your fur babies like I do, just make sure you're not up in their face and letting them lick your mouth or anything like that, especially when you're sick. Do we have any questions, Kevin?
Kind of all the same, but if you're going out to the grocery store or you're going out to get takeout food, are there any precautions that you need to take with the items that you're bringing back into your home?
Okay. The question is about going out into public and getting your takeout food or your grocery items. Do you need to take precautions getting the items into your home? I generally carry vinyl shopping bags that are reusable, and my grocery store is no longer allowing me to do that because I can bring germs into the environment. So with the paper and plastic bags, I usually bring those into my home and set them on the floor, wash my hands very good, take out the items, and any produce or anything like that that many people have touched, I actually wash it with soap and water. Usually I don't use the soap, but soap and water, put it out to air dry, and everything else I put away in the cabinets as is, with trying not to touch the bags any more than I have to. Does that sound like good guidance,
That's
Jessica?
very good guidance.
Okay, Kevin, if you will, let's go look at our website here. I'm going to see if I can get that. The new website is actually a product of Department of Social Services, and it's the one I was telling you about that has all of the cool information for all kinds of scenarios. It wasn't working a few minutes ago. We'll go back to the VDH website then. I wanted to show you some features. The frequently asked questions section, they update this daily as we learn new things. So you can actually go on VDH for Virginia Department of Health .virginiaspelledout.gov, and there's a link right on the home page to coronavirus, and click on any of these items you're interested in. And the frequently asked questions, hot topics today are testing sites in Virginia, lab testing criteria for COVID-19, and return to work guidance for health care workers who have been sick. There's also some information on therapies and drugs that are being tested to work with COVID-19, and a little bit on the antibody testing, which, as you know, if someone is positive for the disease, the way the regular flu works, they take some of their antibodies to develop the vaccine that will then prevent others from getting the disease. You have information on special populations, and this one's new with stress prevention, illness testing, and monitoring. Disease prevention is pretty much what we've been talking to, good hygiene. If you've been exposed to COVID-19 or think you have, there's information on what to do there, how to treat yourself if you are in fact ill. what the testing is like and where you can get it, the prescribed treatment for dealing with COVID, and some quarantine public health monitoring rules. And this one was just added stress and coping with COVID-19. What symptoms can the stress of the outbreak include? And this is particularly true with children. Fear and worrying about your health and that of your loved ones. You may change your sleep and eating patterns, difficulty sleeping or concentrating, and worsening chronic health issues if you have those kind of issues. And sometimes during social isolation, increased alcohol and tobacco use and that of other drugs. There's a section on schools, businesses, workplaces. Let's go into the business section and see what advice they give us here. As Jessica mentioned, Executive Order 53 was the governor's shutdown order, where he effectively shut down the state. All of his orders are listed on here. There's some guidance from the CDC. We'll click on that if you have a small business or you work at a small business. They have, let's see, cleaning and disinfecting recommendations for your facility. If you have someone who's been sick, or even if you haven't, it gives you surfaces to clean and what kind of disinfectants you should use on those surfaces. Your electronics, laundry, all the way down, whatever pertains to your business. You can disinfect your vehicle. There are recommendations for that. Personally, I carry Clorox wipes with me everywhere and wipe down the inside of my car every time I use it. And I also use them to clean my hands, which is not the recommendation if you want soft hands, but I'd rather be safe than sorry at this point. There's advice if you're sick, what to do if you're sick. You've gotten your test, it's come back positive. What to do if you're sick and how to care for someone in your home. And the extra disinfecting steps you should take if someone in your home is ill. Do you have anything to add, Jess?
I don't think so.
Okay. Let's see how much time. We just have a few more minutes.
We had one more question.
Okay.
As far as restaurants are concerned, their concern is, are restaurants required to check like the temperature of employees before they go on a shift?
Okay.
In the restaurant setting is
Okay.
what their question is.
So the question is if restaurant employers are required to check the temperatures of their employees before they come on shift. And the answer to that question is no. They're not required to do it. It's recommended that they do that. And certainly if they have an employee who's positive, the health department will find out because of the tracing that we're required to do with every positive case. We actually get information on that person and we contact them and we make a chart of who they may have been in close contact with, and we would make recommendations to those folks as well. Also, we would let the employer know they've had a sick person within their premises and provide some job cleaning the restrooms and the copy areas and the kitchen and common areas. But no, restaurant owners are not required, they're recommended to screen their employees for temperature or other symptoms as they come on, and to make sure they're exercising the general guidelines with regard to hand washing, hairnet wearing, and certainly covering your face and nose during these times is the recommendation.
Now, I have a few food facilities that have voluntarily decided to start doing self-monitoring checks. So like I said, it's highly recommended. It's not mandated or required, but it's a good idea. And I do have a few food facilities that have called in and advised me that they have started doing this. So basically, during each shift, when that food employee or food worker comes on shift, they'll do a forehead temperature check. And they'll ask them a series of questions throughout their shift just to do kind of little monitoring checks throughout. Hey, are you doing okay? Are you feeling okay? You know, or if they look like they're not feeling well, then kind of prompt that question and ask. And keep basically a little list or a little check on that throughout the shift.
That's reassuring to know. Well, that's all that we have for you today. We hope that you will send some questions to either the health department or the television station so that we can answer those for you in the future. The West Piedmont Health District does have a Facebook page, and we answer questions on there if you want to find us on Facebook. And again, the governor talks to us all on Monday, Wednesdays, and Fridays at 2 p.m. and that's free live streaming on WDBJ and also on the Governor Ralph Northam Facebook page. We're going to go listen after we leave here today. But we're here to help. Our job is to help keep you safe and your employees safe. And the regulations are changing every day and the guidelines, and we're learning new things every day. So if you want to visit the CDC or Virginia Department of Health web pages, we can assure you that the information there is updated almost daily. Thank you very much for watching.
Thank you for having me.
Mm-hmm.